That is a great question. And I do have an answer right away because it was something that made me mad.
Mm,
Ev- I was just, I got really interested in research and I started trying to figure out how I could use it in practice because I wanted to really make sure that my practice was evidence based and evidence informed. And how can I really do that with my clientele and patients if I don't have a framework? And I wasn't really sure how to do it, but I started reading research and I started getting madder and madder and madder for around two different topics. One, so much of the research at the time, so this was back in probably the early 2000s, it was before 2010 when I started reading all of this research. And I was looking at it going, why is all this research talking about anxiety and depression when that's out of our scope of practice in many states, in the US at least? It's not, we're not supposed to be therapists in any way, right? So, but why are all these outcomes getting measured in around anxiety and depression when we're not supposed to be doing that? But how does that work? And I just was really confused. But then in the other research I was reading around things like how to treat osteoarthritis of the knee, I would read these things, and so much of the research were these very strict protocols. Like, that's not what we do. It made me so mad. It's like all of this research is out there, and it's not exactly how I work. And so I didn't know how to apply anything. Like, how do I actually do this with my patients? And then I started to notice that so much of this research didn't include massage therapists at all.
mm,
And it made me mad. I was like,
mhm,
well, dang it, I want this fixed. And if I want other people like me to be able to apply and use evidence in practice, then I'm just going to go fix it. Not that I've done that. I will not make any mention that I've done that at all. But I thought if I want more massage research to be focusing around what we actually do in practice and make it meaningful for people like me, then somebody has to go do it. And why can't I?
mm.
So on the day my baby started kindergarten and my oldest started second grade, I started